what would you say are some of the biggest challenges that leadership in South Asian countries have faced? I know that these challenges are unique to each country, but do you think that there are some common challenges that governments in this part of the world have faced?
I think we should pay attention to the South Asian region because, as you know, a quarter of the world's population lives here. So what happens with a pandemic, a global pandemic like COVID-19 in South Asia is significant for the world in terms of numbers, but also there are quite important lessons to be learned about the kind of population, the different kinds of challenges, which might have lessons both for the global north as well as countries in the global south. Now, the first thing to note about South Asia is that it's a very young population. The average, say for instance, in Bangladesh, the mean age is below 28. It's between 27 and 28. So it's a very young population. These are countries where investment in public health has been very low, often below 1% of GDP. And given all of these and other factors, COVID has been remarkably less bad than we had expected. We had, in such poor contexts, in such crowded contexts, for a disease that spreads through contact, we would have expected the situation to have been much worse. Now, there were a number of things we learned in the discussion that we organized as part of this event, which was talking to 3 public health experts from Bangladesh, India, and Pakistan, the 3 big countries in the South Asia region. Now, each of these, there were some differences, of course, but there were some significant takeaways which we should be mindful of. One is that one of the reasons why it wasn't so bad or hasn't been so bad, we shouldn't preempt this, is possibly because it's a young population. It's, as we know elsewhere, especially in the global north, where populations are much older, the fatalities have been much higher. So that would have been one big factor. The second thing is that if you look at the distribution of COVID cases when they have been tested, big urban centers with international airports is where it was worst. Now, clearly the infection came into South Asia from elsewhere. In India, it was Italian tourists, students returning from Wuhan. In China, in Bangladesh, it was exactly the same. So the infection came from outside and it came through travelers and returning residents. And so areas around cities which had big international airports were the worst hit. The most of the region is rural. It is much more remote. It doesn't have that many international airports given its size. So those regions have been not so proximate to infection, and therefore it hasn't yet, at least, spread into the rural hinterland. Thirdly, I think wherever things have, where the control of the pandemic was done well, it has almost invariably been because of strong local government. So you ask about political leadership. Controlling a pandemic in many ways is a combination of strong centralized information and data gathering, which, you know, the expert from Pakistan, for instance, was talking about a COVID resource center based in Islamabad, in the capital, which was at least centralizing all the information that came in, and but also allowing local governments to do their job. Now, in the much doubted case of Kerala, the southern state in India, the reason why Kerala did well is not because of some emergency measures that were put in place now that were invented suddenly, but because there's been a tradition of panchayats, of local governance bodies having a lot more autonomy, a lot more in-depth participation in local populations. So that network And that capacity is what was activated when dealing with this kind of emergency of COVID.
So information clearly plays a very important role in how effectively we can curb infections or the spread. Do you think that moving forward, leaders from these countries can do more to insulate themselves and protect themselves from being affected by such shocks in the future?
Well, I think it's, the only way to preempt future shocks is to use the time, which we've already lost. Actually, all the countries had lockdowns. And the whole idea, as we have seen sitting in Britain, the whole point of a lockdown is to use the time to build capacity, to build health infrastructure. Now, in countries of South Asia, the health infrastructure is very poor, and strengthening that infrastructure, building more testing centers, building more digital platforms for collecting information of tracing infection flows. This is what is required. And in order to do this, you need to have a strong sense of committed leadership to dealing with this. So you need to stay with the problem, you need to divert the budget into it. The long-standing underinvestment in public health is not going to stand us in good stead, especially in public hospitals, which are always the first port of call when there is a serious problem. People don't go to private centers. We've seen this across the region and elsewhere. And these are the most underfunded facilities in the region. So we really need to use this time and do this at top speed.
Join the Maryam Forum.
Join the Maryam Forum.
Join the Maryam Forum.
Join the Maryam Forum.
Join the Maryam Forum.